Hello, I'm Stephanie Green, this is Grace Cassidy and Julie McGee. Grace and Julie are members of the Belfast Mental Health Rights Group, which has now expanded into a wider Northern Ireland mental health rights campaign. I work as a development worker for Participation and the Practice of Rights, PPR, which is an organisation which attempts to put human rights at the service of some of the most marginalised groups in society. So that's what we're about. And we have been working with Belfast Mental Health Rights Group now from 2006. Originally set up in North Belfast, but as I say, has now grown more widely. Grace would like to speak a little bit in particular about a change that Belfast Mental Health Rights Group secured for an NE service. It's about follow-up care in NE service, and it was a campaign called The Card Before You Leave. So Grace will tell us a little more about that there, and in particular about the issues around participation we had in actually not just securing the change, but making sure that that change was really helping people on the ground. And Julie will, she would like to tell us about her, a little bit more about what happened to her brother. Her brother died, and there was a serious adverse incident review into that. And her family were involved in that serious adverse interview, and she'll talk a bit about the changes around she campaigned for, along with our support, to get changes for families in serious adverse incident reviews. So that's just a little bit about background to PPR and Belfast Mental Health Rights Group, and I'll maybe now pass over to Grace, who will tell you a little bit about the Card Before You Leave campaign.
Yep, okay.
Hello everyone, my name's Grace, and I've been a member of the Belfast Mental Health Rights Group for about 7.5 years now. I'm a carer for my son who has tried to commit suicide twice and has now left disability. So he has. And one of our biggest campaigns that I've been involved with was The Card Before You Leave.
I move the microphone just a little bit closer to you.
Sorry.
No, you're okay.
Oh,
You're
I'm
okay.
nervous.
It's all right, take your time, take your time.
Right, well, one of the biggest campaigns I've been involved in is The Card Before You Leave. And that there would be very, very important to me. Because when my son was discharged on his first attempt, I was told I would have an appointment within a week. It's 8 years down the line and I haven't received it. So this is why our group come up with The Card Before You Leave, that they get this card leaving and that they're kept in the system and they're not lost in the system. And this is what we were all really, really wanting, and we got it. So that was that our wee point. So it was. So in 2010, the Health Minister, he launched a Card Before You Leave. It was the idea that came from our group, and it's service users, carers, and people who have lost loved ones through suicide. So it is given to somebody who is in like a mental health crisis and maybe don't have to stay in hospital or leave, and they get this card and it keeps them in the system. Since the Card Before You Leave was introduced, we've been trying to make sure that it's working properly on the ground. To this, we've been involved on the Card Before You Leave, the Health and Social Care Board, to monitor how it was implemented. And one of the biggest challenges we have found is that it's in different trusts, our card is implemented differently. It's not done the same thing, which should be the same thing for every hospital. It shouldn't matter what A&E you go to, you should get this card before you leave if you're in a mental health crisis. We also found that it was really difficult to get proper information about the card before you leave. Why it was it working, for example. Despite an evaluation of card before you leave in 2012 highlighting that 160 people a month were getting the appointment card, the Trust have now been able to not give us any information about how many people get the appointment card now. Having information from the Trust about the card before you leave is being implemented is really important, because we are hearing stories on the ground that people are still not getting this card before you leave. In fact, when we did surveys last March with people in mental health crisis at A&E, not one person we spoke to got card before you leave. It is important that card before you leave works properly at A&E, because it's essential. It's essential. I can't get that word. Essential that people in mental health crisis aren't left out of services. They need to be linked into the services properly and get help quickly. It is important that card before you leave works properly at A&E, because this scheme came directly from people like us. It was our idea, and we fought for it to be rolled out across Northern Ireland. The decisions that the government makes about healthcare at A&E must involve people who know the most about what's needed. Service users and their carers need to be involved. Thank you.
Okay, Grace, thank you. Julie, do you want to then say something about the experience of your family, and then?
Yeah, hello, my name is Julie McGee, and I have been a member of the Belfast Mental Health Right Group since March 2012. My brother took his own life on the 29th of January 2011 after leaving Belfast City Hospital A&E while waiting to be sectioned. I would like to tell you a little about what happened that day at A&E and my experience of going through a serious adverse incident review in April 2011, and the changes we have tried to get since then, so families are treated better than mine were. Johnny hadn't been well for a while before that. Johnny told us that the psychiatrist had told him that he had been diagnosed as being psychotic in 2010. For us, we could see that he had been paranoid and depressed. And that morning, I rang the police because my tablets were missing, and so was Johnny. All that day, I didn't know anything. At 6 p.m, the police rang me to tell me that they had found him and that he had injuries, and I didn't know at that stage that he had slit his wrist. I rang the A&E reception at City Hospital and told them to make sure that my brother didn't leave until my dad had arrived, because he had a habit of walking out, so I needed to make sure that he was safe. But despite finding out later that the hospital classified Johnny as high risk, they still let him go out for a smoke and get food unsupervised during that time. The hospital stitched Johnny up, but I don't think they looked after his mental health. He was there until 1 a.m, and he should have been sectioned under the Mental Health Act, but this never happened. They couldn't section him until another doctor signed him off on this happening, and the doctor never arrived to do this, and Johnny left without the help that he needed. After leaving Belfast City Hospital A&E, Johnny made his way to Lisburn. I found out later that he also went to the Lagan Valley Hospital that day to get help. They didn't help him either, and have since told me that they don't have any records of him ever being there. Despite all his attempts for help, all the time he spent in A&E, Johnny died later that day. Johnny was failed both by the health services and the police services. I've been through both systems trying to get changes put in place. I'd like to tell you about trying to get changes in the health services now. This is about the serious adverse incident review. The Trust contacted my mother about having a serious adverse incident review. I didn't even know what this was until all this had happened to our family. I felt that we didn't get enough information about the review from the Trust, certainly no written information. It was all verbal. I said to the Trust that I would be bringing a note taker. I brought Stephanie with me from PPR. However, on that day, the chairperson was very unhappy about Stephanie being there, and I said I already told them that I was bringing a note taker. Then a big argument started. I demanded that I was not going in until the note taker was allowed in. I felt really angry and frustrated. You shouldn't have to go through that when you're going to hear what happened to your brother. And when we got in there, they had 20 people there who had been responsible for the care of my brother, and they also had people there taking notes. Why is it one rule for them and a different rule for us? I felt very intimidated and nervous because I'd never been through anything like this before, and so many people were around that table. I knew my brother for 29 years, but felt that my voice was not important, as we had to wait till the end to speak, and it's hard to remember all the things that you had wanted to say by then. Coming out of that room, my whole family was upset to me, and the rest of the people there just went on with their lives. Following all this, I wrote a letter to complain about what happened at the series after Senate review, about the argument that took place in the public hallway. I received a letter back, which I was not happy about at all. It made things worse for me at the time. It took a lot of months and struggles, including meetings with MLAs and chief executives of the trust, plus using the press and also taking part in reviews of how families are involved in serious adverse incident reviews. But we finally got changes. Families going through serious adverse incident reviews are allowed to bring a note taker. A family liaison officer was appointed by the trust to support families. A pack was developed to give to families more insight into what serious adverse incidents are about. Finally, it was agreed that families could speak more often during the meetings, and that better venues would be found for meeting themselves. The last point I would like to make is that the serious adverse incidents are important for families, as they give families answers, but they are also important for trust to make sure that they learn lessons and make sure other families don't have to go through what mine did. And I would like to see greater evidence that the learning is actually happening. Thank you.
Okay, thank you. That's really helpful for all three of you. I have a small number of questions. I think the first one is probably to Stephanie and Grace, and then Julia might want to ask you something about your experience of the serious adverse incident process. But in terms of the card before you leave process, one of the issues that's come up before the inquiry has been good ideas in different trusts and whether they are rolled out across trusts and how that happens. And this is a very good example, it seems to me, of a good idea which then you wanted to see rolled out across the trust. So I wonder if you can tell us, as somebody who has been at that involved in that process in an implementation group, how in practice do you think trusts and through the board and trusts, how good are they at actually rolling out a good idea across trusts? And then my second sort of question with that is, you talked about it was implemented differently in different trusts. If you could say a little bit more about who did it well or who didn't do it well, or what was the difference between the different trusts and what you think caused one trust to implement it more effectively than another. So just your experience about how good trusts are at rolling out practice across Northern Ireland.
Take Joanna's story.
Yeah, there's quite, maybe if I can remember. It was a fascinating sort of experience, seeing how something could be taken from a small idea right through to implementation. One of the things was just staff from NE and mental health services sitting down together. I think this was something at the time, going back to 2009 even, that seemed to be like quite a rare occurrence. And even said themselves that, this is a good start where, people are coming together from both NE and mental health. One of the things we found frustrating, and it was frustrating for the trust members, was you would come to a meeting and we said, look, there's so much information. It used to be like verbal sort of presentations about how it's card before you leave was being implemented in each trust. And it's actually quite hard to follow when people are using acronyms and they call different teams different things, and it was actually quite unclear about how things were being implemented in different trusts. And we had said, as it was part of our thing about monitoring participation at those meetings, was to say, look, could we have a template where you use just a written template where you sort of write down, this is how we do it? But actually, I don't think we ever got that. And actually a member of one of the trusts, I think it was the Belfast Trust, says, it actually would be really useful for them as well, because they found it confusing. So sometimes it could be very simple things, information sort of like a key issue, getting information, consistent information, so at least they could compare, oh, this is what we do, and here's what's good, or here's what's... in terms of areas where it seemed to work better, the Western Trust always seemed to come up quite well. They seemed to be...
It's Christy.
No, she was Northern Trust. Northern Trust was, very involved, I would say, and very proactive. I know the group visited Altnagelvin, which is Western, and they seem to have a very good,
positive feedback from Antrim.
And they seem very keen and positive. So all I would say is the positivity came from those areas at the time. And I think if you have a positive go-get attitude, it seemed to come out more in practice then in terms of the implementation. Funny, Julie mentioned there about one of our group members' experience of Card Before You Leave, and still an ongoing issue. And this is about different trusts. She is a Belfast Trust resident, but would go to a hospital, which she goes to the Ulster Hospital, which is southeastern. And she has been given Card Before You Leave, but it hasn't been in the format which was agreed, but that's another story. But what's supposed to happen is there's contact made with the Belfast Trust, and the Belfast Trust then contact her and say, come to us for an appointment within 24 hours. But I think at least twice that there hasn't been any follow-up with her at all. No. She's had to proactively seek out the appointment herself, with varying degrees of success from my memory.
And was that the problem at the Belfast Trust end, or was it at the South East Trust not initially contacting them? Or
she seemed... Sorry, go ahead. Yes, go ahead.
Sorry,
Julie,
what it was when I joined this group, it was you have to wait on a phone call or a letter. People never get that. There you go. Grace is waiting 7 years later to get hers. So this is why the card was implemented.
Have an appointment.
So to have that appointment the next day to secure it.
You shouldn't be getting a phone call, really. Yeah.
So we're still going back to the old ways, a phone call. She still got the appointment card, but she still had to wait on a phone call.
And the card only said, basically, it didn't give an actual appointment time. And that's what happens when there's issues, when trusts do things their own way.
Because they say she should be around the Belfast Trust. But whenever something happens to her, she needs to go to hospital, she's done something to herself, they send her to Southeast, what is it?
Ulster, the Ulster
Hospital. Ulster Hospital. Yeah. But they say because you live in Belfast now, you have to go to Belfast Trust. So then they're phoning stuff through the Belfast Trust and nobody's getting back to her, and this wee girl's suffering.
This was something very simple, a Card Before You Leave. Mm-hmm. And it's turned out to be not very simple. It's been very, very complicated the whole way down the line. Like 8 years after what happened to my son, we're still hearing stories of the same thing happening. And this card is really important to people. At my time, I needed it because I hadn't got a clue about mental health. Didn't know a thing about mental health till I at my door. And now I know a bit more about it. But people don't know where to go, what to do, or anything when they've got somebody there who's in crisis and trying to take their own lives. It's really important. We small card for an appointment.
Look, it's clearly a really sensible idea. Not that we are, but if we were the powers that be for a second, and based on that experience, what is it you'd be saying to, if you like, the powers that be that you need to do to make a simple idea like that work? What is it that they didn't do?
I think we'd need to come up maybe with an idea again of what way we want the Card Before You Leave to work, which we've already done, and give it to one person to go into each hospital and work with everybody in each hospital and try and get it implemented properly that way. I think would be a good idea. Just one person to deal with it and go into one trust and show them how to work, and each trust how to work it out, instead of
having
different trusts doing it
it
different ways. And if it's done the one way, everybody will be doing the same thing.
One thing I would say is, I think as I mentioned that, or it was in our submission, that the group actually record their participation in meetings, And these meetings are there to get change and make sure that change is consistently implemented, sort of,
Yeah.
and to work out ideas, which maybe Grace has mentioned there. But the standard of involvement that we recorded over the years was extremely inconsistent, if not poor, very poor at times. But once we did press on the issue, say, look, our participation is poor, it's getting worse, things, we are not being listened to, so we had to put further pressure using media, things that we didn't, we tried to bring all these issues up at the board itself, at the implementation board. And when it's not listened to there, you have to find other ways of putting pressure on. But once we did that, they did start to listen and improvements were made. And those improvements in the participation group led to improvements in Card Before You Leave. It was finally implemented in the way that was agreed, which was basically an appointment card, as it says, not phone calls. But that took all that pressure. But we only had a few meetings where that participation standard actually improved. And then something happened. It was actually, I'll tell you, it was the group had wanted the meetings audio recorded as a way to improve their participation because they weren't getting minutes and time to prepare for meetings. That had been agreed. But one of the trusts then disagreed. And they basically pulled the rug under the implementation board and closed it down, so the group was no longer involved in it. And to be involved in the implementation again would have been involved in this very elaborate structure, three-tiered structure, which the group didn't have the time as volunteers to be involved in. So, I say, apart from a small window where the not only did the participation improve, but the actual, you could see the improvements happening on the ground. Things were moving on, and unfortunately,
It slipped
again.
Way.
Yeah. So
because we aren't on the board.
Yeah. So the participation for the health boards to take seriously, because it's been a fantastic. More of this should be happening. You get sort of real small practical changes which are helping people. But there's so many obstacles. Even Julie, when she was talking about the serious adverse incident, that was about A&E. Julie and her family were there, and it was part of a process to find out how the whole thing about sectioning, whatever it was, at A&E could be improved. But if the participation at that level isn't good enough, then you're not going to get not only the real lessons learned, but as Julie says, how do you even know when those lessons have been learned?
Mm-hmm.
And it's the same with Card Before You Leave. We still don't know how many people to this day are actually receiving it due to their information gathering.
Okay, one quick question and then one to Julie, then that would be me. Out of interest, which trust pulled the rug from under your feet?
Belfast.
Okay, and that was based on they were uncomfortable with having the meetings
And she was asked
recorded?
Really
No, hadn't been to the
they
previous two meetings.
hadn't been to the previous two meetings.
Where things had improved.
Where
Okay.
things had improved, so.
Julie, I wanted to ask you, in terms of now looking back on the experience that you had, and you talked about some of the changes that came about as a result of pursuing a complaint and family liaison officers and recognising that you should have a more participative role rather than wait until 20 other people had spoken, etc. But looking back now, alongside of those issues, what else do you think, if you had to go through this again, and heaven help you that you ever do, what would make a difference to you alongside the things you've mentioned? What else would make a difference to you in terms of involvement of family in serious adverse incidents?
Well, since I started this, right, and having the meetings with the trust and all, they say to my face that we really appreciate the information from service users, right? And I don't want her to be lying to me. I want her to tell the truth, but she really mean that. Because the meetings that I had with her, the last meeting that I had, she just basically dismissed me. And like, I want to know that this is happening. Mm-hmm. But if she's dismissed me, how am I supposed to find out that the information and the recommendations and all are put in place? I am a service user myself, so I've got my own issues going on, so I can't monitor it. So I'm hoping that from what your question that you asked, I'm not too sure about your ones, I need you to repeat that again, but
But it's just what would have made a difference to you?
Difference.
And if somebody was,
to me,
let's say somebody today was coming to you
the
and
difference
said,
is that when I went in there, I was told nothing, had no information, didn't know what it was going to go about, and the only information I got was from the guy, Pips, that they've been through it, they know what it was to deal with, and for having to go in and having that argument at the start is not right for somebody, and they knew I was taking a note taker, but everything was verbal. There was nothing written down, so it's my word against theirs at the end of the day. It was wrote down on a piece of paper, like I had the note takers, and anything could have been said in there, and then I would have went away with nothing. So it helps that I've got the changes put in place, a family liaison officer, and more information about it, so that the families don't have to sit and go, what's going to happen next,
I think the issue here is information. Information's key.
It's all about information, because
if people have got the right information of how to deal with things, and to get, when you go to A&E, say with maybe a mental health crisis, not just to be, oh no, away you go or whatever, to give them information of what they need and how they can be helped.
Yes.
So I think information is key to everything.
I will give my story. I've just been diagnosed recently with personality disorders. My psychiatrist says you have personality disorders, right? That's all he said, you have personality disorders. He didn't give me no information of what it's about, how I'm meant to help me, how I'm meant to deal with it. So I walked away from her, and I'm like, where did I go get my information? Where did I go seek it? On Google, on the internet. But these doctors and all are telling you not to go there. So where do they get their information from in the first place? If they're saying not to go there. So how am I supposed to find out what personality disorders is, and how am I meant to help? And that was two appointments ago, and I still had no information about it. So it's all about information at the end of the day. But when they tell you something, they're not giving you information. So what were we supposed to do?
yeah.
I'd just like to pick up on what Julie says, just about at the end of a process in a serious adverse incident, which again is about changing practice at A&E. And Julie made very specific, our family made specific recommendations about A&E, about the sectioning process. But she was never given any follow-up about really, is it working? How do we know it's working? That type of thing. So, although it says it has changed, how do we know? Is it working? Has it been monitored? Are people? Yeah, it's that type of thing. Yeah.
Well, it's my final question about it is have you from PPR any sense that the changes like a family liaison officer acts to bring in a note taker, to have an earlier, to have a much more earlier engagement, if you like, in the meetings with the person who's family members? Have you a sense as to whether actually things have improved or not, or you just...
In the process, yes. From what we've, because we've been involved in other serious adverse incident reviews with other families since then, and certainly, yes, people were allowed to ask questions during the processes towards the end. They could take a note taker without any problem. More people from the family were allowed to attend. It used to be like, oh no, we can't have more, than a certain number. It is relaxed, and it's more family centred. And I think they got the booklet as well, which Julie was part of drawing up, a very family friendly sort of book about the serious adverse incident review.
See that they've done all this. They have not come to me and says, Julie, this is what we've implemented, this is how it's happening. Why am I different from the trust to say, yes, here, we can implement this, so we're going to watch over you? Nobody gave me the right to do that, but they have the right to take credit for what I done. Well, I'm not looking credit, because I'm looking to help people,
Sure. Okay, thank you. Marion?
We've heard from some of the trusts when we've asked them about how they meet the needs of people with mental health problems, that some of them have access to 24/7 psychiatric input at A&E, and some of them have more restricted access. Are you aware of increased psychiatric covered emergency departments?
Yes, what we know that there was more. Well, how can I put this? There seems to be more people getting psychiatric assessments on site at the time, as opposed to coming back for an appointment later on. At the same time, there may still be an issue with waiting times, and we don't know about the quality of those assessments. We've had varying reports about the quality of the psychiatric assessment, that they're a bit rushed. As far as we're aware, those assessments should take up to 2 hours, whereas we're hearing they can be very, very short. So we're a bit concerned about the quality. And that is backed up from the Royal College of Psychiatrists as well, who are concerned about that issue, about the quality of assessments at A&E.
And is any work being done to address concerns about quality? Or?
No, I'm not aware. I have no idea. Don't know.
The other question I have is, you have in your submission, you've detailed that there's a differential rate of access to emergency care services depending on levels of deprivation in a community. And I'm wondering, have you any data also on whether there's a link between levels of deprivation and incidence of mental health problems in the community?
There is a lot. There's quite a lot of data about that there. So there is
a lot of deprivation going on, and it is to do back with where you're brought up in the area that you're brought up, and none of these politicians are helping where I come from. You know, I'm from a shore road, and there's not a shop along there. Politicians don't do nothing to help us, and it is deprivation. The houses, the other states are run down. There's nothing to do. There's no jobs. Your morale's so low for these people, young people around here. Deprivation is a big part of it to play in.
But there certainly are. I mean, that's what we base a lot of our work on, is, you know, looking at the figures, and those are figures, and sort of there's always been like a high correlation between suicide rates and.
But mostly what I'm hearing is when people take suicide, the hospitals are quick to blame drugs and alcohol. They're not looking into their backgrounds or what happened to them in their childhood, you know.
What's causing them to take their own lives.
Well, given that, is there any particular projects that either funded by the Public Health Agency or promoted by the Public Health Agency, which is looking at addressing the mental health of communities where there is high level of deprivation?
I think there, but with any type of project, it can be very short term. That's all I'm worried, you know.
It's about funding and money. At the end of the day, they start up some project and it could be shut down. You don't know how long it's there for.
But there's none specifically.
Well, no, you aren't. I mean, these
what
are
kind of
people.
projects are you talking about? So, where I live, like, there's nothing there. There's a park with 2 swings and a slide, like, and that's for the whole shore road, like, and there's not even a community centre where I live, so there's nothing there for them. For them to go as teenagers and do things. Everything's about money. It's all about money nowadays.
Okay. I'm interested in the Card Before You Leave scheme, and I'm wondering, is there any suggestion that the cards stop being issued because there was an increased number of people on the waiting list then, or having an appointment to see psychiatrists? No, did the card actually increase referrals to psychiatry and then cause blocking in their systems, or
I don't think they even have the data on that there at the moment. This is the whole problem, that although there was a good evaluation in 2012 of Card Before You Leave, now they're telling us, we don't have information on this, that and the other, so we don't even have that information. So I think in the evaluation they must have had some information, and they said, you know, so many people were going into getting support through mental health services who never got it before, or who wouldn't have got it before, because basically you'd have been sent home with nothing. Because these are lower risk people. But just to remind you that the group didn't set out for Card Before You Leave just to be given to people at lower risk. They felt that everybody at any hospital, A&E or inpatient, should not leave with something in writing for their next follow-up. Because too many things have gone wrong. People haven't got letters in the post, or they don't get the phone call, or something happens, and it's a very risky time. So although it was the health board itself who cut it down to it's just for people at lower risk, but somebody who's at higher risk, for example, who goes through their assessment, may well be, they don't get an appointment from any to say, right, you have an appointment with a psychiatrist in 9 weeks' time or whatever. They have to wait on that. So it's that waiting, and the family worried, really concerned about that person while they wait for this appointment, which in some cases doesn't come for whatever reason, you know.
Well, my son was just never linked into the system. He was never ever going to get the card. And he was discharged that week. And the following week he jumped off, 2 weeks after, he jumped off the roof of my house, where if I had had that appointment, he would have been in hospital.
Yeah.
And then I might be sitting in the situation I am today with a son with a brain injury and disabilities.
I find in any appointment that the NHS is giving out now lately, if you miss one appointment, you're discharged. Because and it's not on. It depends what thing you're going to. Because I was discharged after a couple of appointments, to maybe your second appointment. They're quick to discharge you because you didn't go to that one. People can't remember and forget now, and
Depending on the nature of the illness.
they're quick to dismiss you and discharge you.
This is why
Not phone you up and ask, what, could you go to this appointment? Why did you not go?
But this is why we wanted that not only the person get the card before you leave, but the carer of that person get one as well, so that the carer has that appointment for them and they know, right, you have this appointment and you have to go to this appointment. So it's essential that, you know, it wasn't just the person with the mental health issue get the card, the carer gets it as well.
Thank you very much. Thank you.
Paul?
Many thanks to all three of you. Really appreciate it. Terribly helpful for us. I'm most grateful. I'm also very grateful for the submission that you prepared specifically for this inquiry, and it's a very rich submission with the identification of these key issues, 3 of them in particular, and some research accompanying it as well. So, for instance, on page 3. You report to us, interestingly, that by March of this year, 66% of those who took part in our research, following an attendance at A&E, viewed the waiting time as unsatisfactory or very unsatisfactory. So, and that's just one little example. There are lots of sort of nuggets of useful information in your submission, so thank you. I have one question about PCC. Would you care to comment, if you're comfortable doing so, about the Patient-Client Council? Would you care to comment if you wish?
I did go to a couple of the meetings with one of my colleagues.
If you could comment how useful they've been, or not useful, or consistent, or whatever. I'm interested to hear any comments about PCC.
I think we left and we didn't bother coming back. I think we had a couple of meetings and it seemed to get too much over for us or something, and we didn't go back. I think I went with Kathy.
You did.
To a couple of them, and it just got a wee bit too much for us, you know, for the check in things and stuff, and we didn't go back till them, so we didn't.
Were they too long or something?
Yes, some of them were too long, and then they were talking about things that really didn't relate to us as either, you know, as a group. It didn't relate to us, so we felt a bit uncomfortable, really, that there was things that were getting talking about and going on about things that we didn't really connect with.
Julie, have you had anything to do with the Patient-Client Council? No,
I didn't go to none of the meetings.
Stephanie, have you?
In terms of one-to-one support for people, helping to write up a complaint and organising meetings, I think that's a very useful, very good role. In terms of things that we've brought to Patient-Client Council, they've never gone anywhere really. Now that's not to say individual staff haven't been supportive and helpful and things like that there, but just really things never. And then when you bring certain ideas or thoughts or things and nothing happens, you kind of just sort of lose interest. It was things like, and then they would come to us for like, sort of, all they seemed to want was like input into a corporate plan or something. You know, it wasn't really stuff that we were.
Okay.
I don't know if that makes any sense to you.
That's helpful. That's really helpful. I'm just trying to get a sense of how they're perceived. And similar question, but this time around the PHA, the Public Health Agency, and its project of 10,000 Voices, which we've heard quite a bit about. This project of 10,000 Voices, of getting people to tell their stories, so that the health system in Northern Ireland and the Trust can be more responsive to the public. So there was this big project, and we've heard some good things about it. Some have been less good, but on the whole I think they've probably been positive. And I just wondered if you had any experience of 10,000 Voices, that PHA project, whether you'd been included in it.
No, I was actually talking till We had a meeting on Monday, and there was a fellow called Stephen, and he actually must do something with that there, because I remember him talking about would we be interested in doing it?
Right.
And I think, well, if we all tell our stories and everybody get their stories out there, because mine's not just one story, there's a lot of stories out there, and I did think I said to him, yes, I thought it would be a good idea, everybody getting their stories out.
I think one of the things about that there, I mean, group members and other people have give their stories for many years, and there's many rich stories there that've been collected. I know the group often say, you know, some people join the group and say, you know, I'm tired telling my story. I want things to be done now. So this group would be very much about, you know, right, stories being told. A lot of things happen time and time again. Let's engage in the business to get the change.
Yeah.
You know, so I don't know. It's just the group would maybe be a little bit worried just of
when
going
you're
through that.
Yeah, when you're thinking of 8 years down the line after what happened to me, and it's still happening to people, you know, so nothing, you know, would really do need change.
Well, the way I see it, right, the NHS has money for people with cancer and other stuff. See people with mental health, because you can't see in people's heads, they're not willing to do anything. They throw the money into people with cancer, they sort them out, and other children with other stuff, and they can't deal with people with mental health. And
I think because
they
mental
can't
health,
see in
you
their
can't
head.
see it.
They think it's all in their head, but it's not.
It's an illness that you can't see.
Yeah.
You know, if you go to the hospital, maybe with a broken arm, they can see it. Or you're going with chest pains and it's
And they'd
hard,
rather deal with
they
them
can
people
see
first.
all that. But if you're sitting there, I'm sitting here, would you think I maybe have a mental health issue? No.
No, do you think I have
But,
one? No.
you know, and this is what it is. I think it's, what do you call that, like a stigma with mental health too. A lot to do with stigma. And people don't really want to talk about it. But
No, they
I
don't.
think they do need to.
Only till it hits their doors, even when it does hit their doors. Like, see when somebody gets murdered, they have a family liaison person there for them coming out and comforting them. And I didn't have one when it happened to my brother. And even then when I got one put in place, he wasn't there to help everybody with suicide. If they weren't on their system, they'll not go out to them. So the reason why I got him in there for in the first place isn't going to do the job what I wanted him to do. So you're paying him money for... I don't get it. You know...
Just because we're out of time, just one last question, if I may, and it might be you don't have views about it, which of course is fine. The human rights-based approach, as we all know, requires as much participation as possible. You know, it favours a bottom-up approach rather than a top-down approach. But participation is complex, actually. It's complex, and it requires a whole variety of processes and institutions. And one way of engendering participation is for decision makers to reach out to communities and secure the views of the public and patients and communities. So that's one way, decision makers reaching out. I mean, another way is for members of the public, patients and communities to be part of the decision-making process.
Yeah.
That's rather different. Now, just one example of that second approach, that is decision makers including the public, patients and communities. One example of that is that trust boards, as you might know, the health trust boards, have 6 non-executive directors. And my question is, you know, in your experience, do these 6 non-executive directors of the trust boards, do they provide, in your experience, some sort of voice for the public, for patients, for communities?
I don't think he's speaking on my behalf. Like, he didn't come and ask me, what help do you need? You need to come and ask the public. That's only my answer. It's my answer.
I can only think of one experience of involvement with non-executive trust members, and it was a meeting way back before carbon-free leave was even implemented, and there was two executive, a chairman who I think there was one non-executive director there, but to be honest, didn't make any difference. We had a meeting about card before you leave. It was the Belfast Trust, and it was an awful experience. Now that was with one. Sorry, there was three members of the board, and 2 were executive and 2 were non-executive members. Or sorry, 1 was non-executive. So the non-executive member didn't make any real difference to the process.
Right.
And in fact, they said they would follow up and do X, Y, and Z, never did X, Y, and Z. And we just bypassed Belfast Trust and went to the Health Committee and Health Minister in our attempts to get Card Before You Leave implemented. And that was a successful route.
Right.
But as I say, that one experience with one non-executive member didn't make any difference to a process. That's all I'm saying. So, as I said, I don't think we have any other experience of non-executive directors reaching out in any way. No, not that I can think of. No.
Okay, thank you for myself. Thank you all very, very much.
Okay.
I've got one final question, and I'll just echo what Paul said about how useful the material is, and it's been very good. And it's clear that there are 3 or 4 key areas that you have talked about in your reports. One was insufficient access to information, and how important it is to have proper information. One was excessive waiting times and to deal with that issue. And the third was about problems about follow-up care. And I think, if I picked it up right, there was a sort of 4th issue, which is about data collection, and that there are things needed around data collection. Now, we've explored a number of those issues. The card before you leave is one. The family liaison officers and the serious adverse incidents is another. But I wonder, before we finish, are there any other recommendations or suggestions you have around those issues? For example, what it is you think should be tackled on data collection, or any other issues that you think should be addressed by the trusts or our report. And also, if you think there are any good practice or examples that we should be honing in on and highlighting, for example, because they might be very useful to be rolled out elsewhere. So just anything we've not covered in terms of the areas that PPR and the mental health group have focused on.
In terms of the data collection, if there is a change that has been secured and implemented, it's really important for those who've secured it and campaigned for something to know that it's happening, so that information is there, it's collected, it's for public consumption, to prove that, because when we get stories from people saying, oh, we've never heard a card before you leave, or we're not getting it, we have nothing to say otherwise at the moment. So that really it puts people off even getting involved in the ways. They think, well, so many years down the line you don't even know that so you lose trust in a process if you don't have that data. Absolutely. It's just important to keep people going. And to know something is working and it has been value for money, because you think of all the time and hours that has been put into this, that one campaign for one small change, and you don't even know.
And we're all volunteers, and we do this all with our own free time because we want the change, because it's something that affects us all.
So it makes you wonder if the data's not being collected at that level, how are other things, like bigger things,
As it's just a wee piece of paper, how's the bigger things getting monitored?
Yeah.
As people monitor news, you're doing their job, you see.
Suppose in the participation indicators that which the group used to measure their involvement in meetings is crucial, because that was the tool that was able to put pressure on particularly the Health and Social Care Board. And it's evidence, it's hard evidence, and you can use that whether you're going to the minister, to the media, whatever, to say, look, here's what happens. And when you don't involve people properly, things go badly wrong in terms of the change. The change isn't the change you thought it was. And also, I remember when we were going to give a presentation to, it was a public meeting of the Health and Social Care Board, And we had all that evidence collected. We were going to shorten the presentation, at which media were involved. It was a public meeting. And it frightened the life out of the Health and Social Care Board at the time, because they really didn't want this. But at least they sat up and took notice of that. And suddenly we had an important meeting with the most senior officials. We got apologies, we got changes, and those led, do you remember I was saying earlier about the changes? There was a couple of really good meetings. We had extra administrative support, just things where we're just, and I thought, yes, if that could happen, that would be great. Now, we have tried to get the Health and Social Care Board on board, trying to get, and not just this, other groups using that process of measuring their participation at meetings and using it to get change. And it really, although they have said that they think it's a really good idea and all, but we don't see action happening on it. And we've had meetings, I think, with when I was away, there was meetings, but nothing has happened. It hasn't been rolled out. Nobody's got back to us about it to say, right, we're doing X, Y, and Z about it. So that's highly unfortunate, because that, to me, it was the core tool that the group has used and has successfully used to improve their involvement.
Okay, thank you. That's been really, really helpful, and as has your materials. As we've said to everybody who's given evidence, if there is any additional material that you want to give us, we'd be very welcome. And really an opportunity just to see if you have any final comments, any one of the three of you would like to make, or anything you think we've not covered, or augment anything that you've already said.
I suppose just on the participation, when you talk about participation indicators, everybody glazes over. You know, that sounds like, well, what's that? But they're really simple things that people can use. Yeah. It's just something like, it's like a checklist to say, you know, is information provided in a way that people can understand, or I don't know, did you get the agenda on time so as you knew where the meeting was going to be and what was on it and contribute? You know, it's really simple things, so it's nothing to be. A small improvement on participation could make bigger improvements on outcomes on the ground.
And you set them out in your submission.
Yeah.
You set them out in your submission.
Yeah. Okay, Stephanie, Grace, Julie, thank you very much.
Thank you.
That's been really helpful and very useful. So thank you for giving up your time this
afternoon.
Okay, thanks very much.